is ulcerative colitis, Crohn's disease, and irritable bowel syndrome. And you must pay attention to those three things. So we have the first one, which is inflammatory bowel disease. Please, is different from irritable bowel syndrome. These two things are different. Inflammatory, I will say IBS, and inflammatory bowel disease. They are not the same. Inflammatory or irritable bowel syndrome. That one, and I want you to take note of that, which is this one. Remember, irritable bowel syndrome. So the irritable bowel syndrome is a functional GI disorder without no inflammation. There is no inflammation, there is no structural damage, there is a normal lab. So what happened in irritable bowel syndrome? The person have abdominal pain or change in their bowel habit. So that means they have diarrhea, constipation, mixed pattern. So sometimes it's really hard to manage this patient because one time the patient will say, I have diarrhea, and you manage them with diarrhea, they go back to constipation. And you manage the constipation, they go back to diarrhea, or they can have both. So that is the major thing for irritable bowel syndrome. And like I said, it's recurrent episode of crampy lower abdominal pain. Okay, so patient may have flatulence accompanied by either constipation or diarrhea. So both is either patient is having diarrhea or patient is having constipation. So pain can be relieved with defecation. So sometimes when they use the toilet, um, pain may be relieved. Okay, and sometimes it might be as a result of emotional stress. So the major thing here is irritation, irritable bowel syndrome. And what are the education? You can tell the patient to avoid gas producing foods. You can tell them to increase their fiber, tell them to reduce stress or exercise, because some people with stress, they start having a lot of diarrhea. So they have a lot of, like, some people when they have an interview or they have an exam, they keep having diarrhea. So it can be as a result of stress. So just tell the patient reduce stress. They need to avoid um, caffeine use. Okay. So that is it. That is irritable bowel syndrome from the word IBS. IBS, irritable bowel syndrome. And like I said, they can have diarrhea, they can have constipation, they can have both. And sometimes the symptom may be relieved with defecation. There is no bleeding, and there is a normal colonoscopy. And it can be triggered by stress, it can be triggered by the food they ate. Okay, so that is why they said avoid onions, and sometimes you need to know some of these things. Avoid gas forming food. So that is the summary. Irritable bowel syndrome. So there is always mix between constipation, diarrhea. Please take note of that. So the major thing here is diarrhea, constipation. So they are fluctuating between the two. It improves with defecation. There is no bleeding. Okay. So this is irritable bowel syndrome. Then let's go to inflammatory. Inflammatory now, no longer irritable. Inflammatory bowel disease. Inflammatory bowel disease. Under inflammatory bowel disease, we have two conditions there. Inflammatory bowel disease. So what are those two conditions? Crohn's disease and ulcerative colitis. Crohn's disease and ulcerative colitis. So both of them are chronic inflammatory condition. Okay, they are chronic inflammatory condition and is causing a visible damage to the GI tract. So patient may have a lot of, when they do like a abnormal when they do like a colonoscopy, is going to be an abnormal colonoscopy. So patient is going to have like ulcers, inflammation. So remember, inflammatory inflammatory bowel disease. It was different from irritable bowel syndrome. This one is inflammatory, so there is an inflammation going on. So the two that we have here is the IBS and IBD. Is the Crohn's disease again, is the Crohn's disease and ulcerative colitis. That is the two that we have there. So let's talk about Crohn's disease, which is the first one. So under Crohn's disease, what happens in Crohn's disease now? Crohn's disease is diagnosed using, it can be a combination of clinical features, labs, imaging, but in Crohn's disease, you will see that there is a inflammation, and this inflammation is happening at any part of the GI. There is the patient will show chronic GI infection. Okay, so it can happen in any part of the GI. That is your Crohn's disease. So what do I mean any part of the GI? If you look at this, it can occur from the mouth to the anus. From the mouth to the anus. So inflammation occurs in patches. In patches. So it occurs in patches. And another thing that is very high yield in the exam is that if this inflammation happen at the ileum, it's gonna have watery diarrhea without blood or mucus. This point is very high yield. But if this inflammation happen at the colon, patient is going to have bloody diarrhea with mucus. Bloody diarrhea with mucus. So depending on where the inflammation happen, sometimes they ask you questions, patient, because you can, that is how you can compare it with ulcerative colitis. So in Crohn's disease, it happens at any part of the GI, from the mouth to the anus. So it affects any part of the GI. That is the first thing to remember. It affects any part of the digestive tract. It can often affect the small intestine or the colon. And another thing you will notice is that patient is going to have a lot of abdominal pain, diarrhea, weight loss, and patient will present with what we call patchy deep inflammation, because you remember it is skipping. Patchy, so they have the inflammation occurs in patches like a skip lesions. So this is what we are saying. Example here. So this is when you compare it with Crohn's disease. With ulcerative colitis, in Crohn's disease, it can happen in patches. This is patches, in patches. But in ulcerative colitis, the inflammation is continuous. So what is the difference? In Crohn's disease, it happens mostly from the mouth to the anus. But in ulcerative colitis, it is just restricted to just the colon and the rectum. So if they ask you a question that this inflammation happen more on the rectum or it happen more on the colon, then you're talking about ulcerative colitis. Another thing is if they tell you that the distribution is a patchy inflammation, like it's keep lesions, if it's patchy area, that will be Crohn's disease. But if it is continuous inflammation, that it is ulcerative colitis. And another thing to always remember is that ulcerative colitis, when you talk about ulcerative colitis, you will see that ulcerative colitis, it will be more of bloody. So if I compare it with the Crohn's, I told you that Crohn's, it depends. If it is in the ileum, it is more of watery diarrhea. If it's in the colon, it's more of bloody diarrhea with mucus. But if you talk about ulcerative colitis is mostly bloody diarrhea. Remember, it is down there. It's either is in the rectum or in the colon. And the ulcerative colitis, patient will be on low residue diet because you don't want to give them something that will be causing more cramping, causing more pain with them. They just need to rest the abdomen. And also remember that in ulcerative colitis, patients, so I like these points that I highlighted here. Avoid anti-diarrhea agents because they may precipitate colonic dilation. So avoid anti-diarrhea agent, anything that will stop the diarrhea. Then they can also, sulfasalazine is prescribed antibiotics and inflammatory effect, but it interferes with folate metabolism. Therefore, folate supplement is needed. So remember, anything I highlight is important too. Okay. So ulcerative colitis, like we said, is inflammation. It starts in the rectum or the colon, from colon and rectum. So what is the most common symptom here? Bloody diarrhea, abdominal cramping, and how do we make diagnosis? Colonoscopy with biopsy, which is a gold standard. So please, that is the major thing to know. Ulcerative colitis, Crohn's disease. In Crohn's disease, it can happen at any part of the GI, any part of the GI. But in ulcerative colitis, it happen more. It happen more on just the colon and the rectum. That is ulcerative colitis. More. Another point, Crohn's disease have a patchy inflammation, like it keeps lesion. But ulcerative colitis is more of continuous inflammation. Please don't forget that. Crohn's disease happen on any part of the any part of the digestive GI. So in summary, Crohn's disease happens in any part from the mouth to the anus. Any part. There is a skip lesion, there is transmural inflammation. Patient, the complication is fistula, strictures, and the abscesses. So if you compare it with ulcerative colitis, ulcerative colitis happen only in the colon and rectum. So when you see the questions, you will understand what they're asking you. If it's just in the colon and in the rectum, then that is ulcerative colitis. But if it happens at any part, then that is ulcerative colitis. Okay. Then Crohn's disease and ulcerative colitis. Please don't forget. And another thing, the inflammation in Crohn's disease, in ulcerative colitis, we said it is continuous, no skip lesion, more of bloody diarrhea. Okay. And patients have more higher risk of colon cancer in ulcerative colitis. It's not that it may not happen in Crohn's disease, but remember, Crohn's disease is depending on the part that is affected. Okay, but in Crohn's disease, in ulcerative colitis, they have more high risk of colon cancer. You may see something like that. Okay, and cancer is increased in both, but in ulcerative colitis, colon cancer is more. Please don't forget that. And this is the table to remember everything I said. In Crohn's disease, there is a skip lesion. In ulcerative, it is continuous. In the depth is transmural, and in ulcerative is mucosal. The one for Crohn's is usually complication of fistula, but the one for ulcerative is toxic megacolon. And I say that cancer risk, Crohn's have a increased risk, but ulcerative have a higher risk, more higher risk. And another thing to remember for more emphasis, the Crohn's is transmural, which means the inflammation goes through all layers. Remember, it goes through all layers. It can go from the mucosa, submucosa, it goes through all layers. But the one for ulcerative, the inflammation just go to the inner most lining of the GI. So when you hear transmural and mucosal, so that is what it means. In transmural, it goes more, the information goes through all layers. But in mucosal, it goes more in the innermost lining. And the one that will cause more cancer is the one that will cause more cancer is the ulcerative colitis. So please pay attention to that, because it's usually a very high yield in the exam, especially which of them will cause more cancer. They will still put the two options for you, then just a confusion. But the one that will cause higher is more ulcerative colitis. So this point is so high yield in the exam. Skip lesion. You can always use the diagram to remember. Just this picture, this is continuous, this is patchy. And the Crohn's will have fistula, risk of fistula, but the ulcerative will have toxic megacolon.